Guys, welcome back to Medical Coding with Blue. Today's episode is all about productivity standards in the outpatient setting. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a comment. I'm gonna read the comment and here we go. All right, so the comment reads, I was looking at coding productivity standards online and some say about 150 per day. Then I was thinking, how in the world do you code that many accurately in one day? Do you have to assign a ICD-10 code or codes to every encounter? Some of the cases in my studies take 3 to 4 ICD-10 codes and a couple of CPT codes. Just doesn't seem possible to flip through all of the books and get that done accurately in less than 5 minutes. Thanks. Okay, so here's the thing, guys. I know this was written by somebody who does not have their credential yet. If you do not have your credential yet and you are out there looking at these job listings and you're looking at the productivity standards and everything, and it's scaring you because you think 150 is a lot, 150 is a lot, but it is doable, all right? And there's a lot of things that I'm going to get into in this video that are going to say how it's possible to hit that. But I will say this, if you are a student, you need to concentrate on being a student. Don't worry about trying to find a job or what is a productivity standard going to be like or what are you going to make if you're still trying to learn medical coding. You need to do one thing at a time because this is what stops a lot of people. They start getting in their head about the productivity and the money and where they're going to find a job and everybody's saying they can't find a job. And then all of a sudden they're distracted when they should be concentrating on studying. So concentrate on studying and don't worry about the productivity standards. I have many videos. I think I have 7 videos about productivity standards that could have been easily remedied by looking through the videos and say, oh, okay, well, she talked about this before, and here we go. Oh, okay. In that, you will see that I say the average for a average place is going to say between 80 and 150. Now, 150 is a little on the high side, but that's typically in places that you're not going to see a lot of variety in the procedure codes that are used, and probably not a lot of variety in the diagnoses either. And those are typically like your very mundane, very same clinics. And so you will have those. Don't ask me, guys, because they vary from place to place. Some places. Some clinics are a little bit easier than others, okay? So, and don't ask me which clinic is easy because none of them are easy clinics. They all have their own specialty things and that you have to still understand. But when they say that the average productivity is between 80 and 150, what does this mean? It means that if your productivity standard at this facility is 100 per day, let's just make it a nice even number, all right? They say it's 100 per day. And let's just say that you do not make 100 encounters in one day. Let's just say you only make 90, all right? And you had a few that were really kind of very difficult, or they had multiple diagnoses or multiple procedures, or there was a really complex thing going on, and so it just took you a little bit more time. And so you're only able to get 90 that day. So what it means is it's average per day. So when you take the next 10 days to do 101, you've made up for that day that you only did 90. All right. And so then when you average it out for 10 days, your productivity averages out to 100 per day. All right. If you do it like that. So that's the thing, guys. It's not anything to be scared of. And especially when you're brand new, you may think, oh my gosh, that's such a high number. I'll never get there. I'm so slow at coding. That's why you're a student right now, so that you can work on your speed. You can work on learning those things. Now, sometimes in these facilities, a lot of them have the electronic health record, right? Or electronic medical record. And because they do, providers will often pre-select their diagnosis codes and their procedure codes. And what happens is we essentially turn into auditors, making sure that the documentation supports the codes that are selected. Now, medical doctors are not medical coders, and I would never encourage them to be coders because that's why I have a job, right? But what doctors are supposed to do is give you the right documentation. Now, if you get lucky and they select all the correct diagnosis codes and you say, okay, yeah, everything's there, okay, great, boom, then you can move on to the next encounter. where they may not have selected the correct codes, and then you have to go back and add and correct the codes. Or maybe sometimes you even have to add codes because sometimes they didn't pick up something that should have been picked up. And so again, that's why we have a job, all right? But with them selecting their own codes, it really all depends if they're good or if they're well trained or not, whether those codes are going to be right. Because you cannot just assume just because that's the code that they selected, that's what they want, that's what they're going to get. No ma'am, no sir. If they have selected the incorrect code, it is on the coder. We are bound by ethical rules to go in and correct to the correct codes that is supported by the documentation. If it's ambiguous, then of course we need to query the provider and find out what happened. So if, with all that said, it does get easier with time. You will build up to those types of productivity. It really all depends. That's why you ask during the interview, what is the productivity standard? And if they tell you any number between 80 and 120, or 150, 120, 150, then you're good to go. You're in a place where they understand what coders do. That there are some places, and I've heard the horror stories in the comments. Oh yeah, Blue, I work in an ER and they expect us to do 320 per day. No ma'am, no sir. If you are in a place and they say that they want you to code this high, exorbitantly high number, like 320 per day, you are not coding. That is not coding. That is data entry. It is data entry. And another person commented and said, oh yeah, 150 is good. That's a little low because I normally do 300 or 600 average per day. No ma'am, you are not coding. You are data entering. There is a difference between people who are coding and people who are data entering. If you are telling me that you are going through 300 to 600 medical records per day, and you're telling me, yeah, that's what I do in a day, that's not coding. That's data entry. That is data entry, because there's no way that you can sit there and level out an evaluation and management or look at a procedure code and find out a procedure note and find out what happened, and then be able to apply all the diagnoses and all the procedures and all the modifiers, and if there's an evaluation and management that is applicable to the situation. That's a lie. 300 to 600 a day coding is a lie. So if you are in a place that they say, well, we want 320 done per day, I would look for another place to work. That's not a place that's going to honor the coder. That's looking for a data entry person. That's what they're looking for, because they're going to trust what the EMR, the electronic health record, electronic medical record, electronic health record, they're going to trust what it says, and they think that they know. And that's people who think that they know. And there's a lot of people in the health industry that think that they know, but they don't know, especially when they don't understand the full capacity of what medical coders can do. This is why I make it a point on my channel that I want all of you to be high caliber medical coders, and the only way to do that is by knowing your coding guidelines, reading your coding guidelines, knowing your anatomy, knowing your medical terminology, so that way these codes make sense to you, that way that you can spot them when you're reading this documentation, and ethically holding to those standards of looking through the documentation the correct way, and not allowing yourself to be cattle herded and pushed to have this really high productivity number of encounters looked at, when the higher the productivity, the higher the number of mistakes that are going to happen. And guess what happens when mistakes start happening? Then insurance money stops. Then all of a sudden there's an audit, and then now we've got a bigger problem, because then now you have fines, because they're going to find something apparently, right? Because there's been too many mistakes. If you have too many mistakes, guess what happens? Here goes all that money out. Now they have to pay, and somebody's going to be in trouble. So that's why I'm telling you, if you are in a place that they say the productivity is between 300 and 600, and oh yeah, that's what I do, that's not what you do. That's data entry. Medical coding, between 80 and 150. And if it's any higher than that, don't apply there. Okay? Don't. I wouldn't, because that's, again, they're just looking for somebody to data enter and be a workhorse. yes, medical coders work hard, and we are considered the workhorses too, the worker bees. But what we do is we look and we make sure that everything is appropriately coded and accurately done. And we do that with a reasonable amount of time, all right, and a reasonable expectation of productivity, not this ridiculously high amount. Because I guarantee you, if they're demanding that you do 200, 300, 400, 500, 600 a day, they're not going to treat their workers well, a place like that. Because really, that is a place that has no respect for what we do as a profession as medical coders. And that's just what I'm going to say there. And yeah, I said it, because the thing is, there's a lot of people that don't understand what we do. But then there's people that know what medical coders should be like, but they're not seeing it because there's a lot of these fast-paced medical coding programs that are just pushing people out there in the world trying to claim that, oh, these people are medical coders, and they have no idea about medical terminology. They cannot tell you anything about pathophysiology, and they certainly cannot explain to you the coding guidelines. Come on, folks. Let's be realistic, okay? Between 80 and 150 average per day should be the standard productivity for medical coders. If you are in a place that's higher than that, I would be looking for another job. I would, because again, it's too stressful to try to push through that many. Now, yes, there's going to be days when you're going to do spectacular on your productivity. My productivity for myself in my clinic is 90 per day, average 90 per day. That's because I'm in a specialty clinic, okay? And I work for orthopedics and podiatry. And they say, okay, orthopedics and podiatry, you're going to have a little bit more, like, you have to think, because there's a little bit more specialty things going on in there. Okay, great. Because I deal with minor procedures, I also deal with major procedures, and I deal with evaluation and management on top of the diagnosis coding, okay? Which can involve injury coding, which involves external causes, and involves all of those things. So that's why mine is a little bit lower than normal for the other clinics in my hospital. So with this, yes, there's days when I hit 90, no big deal. There's days when I can't hit 90 because something's going on. Something's going on. This was a really complicated case, or it was a trauma that came in that they had to go and work on. And so I'm left to look at the documentation. Well, that being said, there's days when I get through and I'm looking at all the documentation. Perhaps it's a day where there's a lot of post-operative encounters, and I'm just flying. I'm flying because they are so good with their post-op documentation. This is the thing I have campaigned on with them for the longest time. You tell me, what did the patient have? What was the surgery? When was the surgery? What is the diagnosis? What happened? And where are they? As far as like, are you changing the bandages? Are you doing all that wound care? Are you taking off sutures? What are you doing? And they have gotten so good at it that on the days where they're seeing a lot of their post-op patients, I'm flying. And so naturally on those days, I make higher than 90 on my productivity. Some days I get up to 120, 125, 130, depending on how many post-op patients they saw that day. And so on those days that I'm able to get a little bit more done because of the ease with which the encounters are, okay, great. Then on those days where I suffered a little bit, I'm not going to worry because I've done days where I've exceeded my productivity standard. Okay, so that's how that works. It's not something to really be concerned with when you're a student because it looks like a lot, but just because you're learning the coding side. And naturally, you're going to be slow. When I was studying for ICD-10 PCS, I was slow. You want to talk about slow? All right. In the back of the ICD-10 PCS book for Optum 360 coding, they have Appendix M, like in Mary. And I was going through and working all of those cases, or not cases, but those procedures that they have in the back. And it's hundreds of procedures. And I said, okay, if I can work through this, then I'll be ready for the PCS side. Because, of course, at the time when I was studying, I'm proficient in CPT, I'm proficient in outpatient coding. It's just that inpatient coding where I didn't have experience. And so that's where I used that ICD-10 PCS book. And I said, okay, if I can work through this, I know I can work on my speed. Well, the first couple of weeks, I'm still struggling through the first couple of pages of it. And I'm like, how am I going to get faster, you know? But the speed does come with time, all right? And then there's going to be things that you pick up along the way, as far as like your efficiency in looking at a note. For me, I always look at the assessment and plan. And for me, that's just the way that it's always helped me to be faster. Because when I look at the assessment and plan, as opposed to starting off at the history of present illness, right? They have the chief complaint, history of present illness, and then they go on and they explain everything. And so a lot of times what happens is I would start in the beginning when I was a brand new medical coder. I would start at that HPI, and then I would work my way down. And then by the time I get to the assessment and plan, I have forgotten all the things that were going on in the HPI. So what I started to do is I started to look at the assessment and plan first, because that's going to tell me how detailed is this encounter going to be? How much brain power did the provider have to use? Because the assessment and plan is going to tell me if they're going to plan for a surgery, if they're going to prescribe them medications, if they're going to prescribe them physical therapy, if they're going to send them to occupational therapy. There's a lot of different things that the assessment and plan can tell me that I can look at the HPI and recoup and be like, oh, okay, yes, this confirms this, and this is why they came in. This is their final diagnosis. This is what happened to them, why it happened to them, the external cause. I love that. And so then it's like, okay, great. Then I've got all of this information. I see everything is good to go. Then we're good to go. And so that's how I end up being able to get through much more quicker. But it takes time, you know, and you're not always going to use your books. You do have access to an encoder a lot of the times. Now, sometimes there's places that they don't understand what medical coders do, so they don't give us the tools that we need, and so sometimes you won't see that they have an encoder. Okay, if they don't have an encoder, then obviously you're going to be with the books, but then you should be fast with the books, because obviously, you know, if you've been studying, if you've been getting through that test, then you're going to be okay to use the books. And then sometimes you're going to have the books as a supplemental backup, because the encoder is not infallible, guys. It is going to make mistakes because it is based on what you are selecting. And if you don't really understand the language of what's going on and what they're asking you, it is easy to select the wrong path. You know, you'll see that in some of these diagnoses. You'll see where it comes up with a symptom code, or you'll see where it comes up with a definitive diagnosis code. So that's where you have to really kind of watch. And it does help to still continue to use your books as a way to, like, okay, confirm. Because if you see a code that comes out on the encoder, it doesn't quite look right to you because of the way that it's described or whatever, then use your books and go through and see if the book is giving you the same thing, or if the book is going to give you additional information. And then you could be like, oh, okay, well, here's what happened. So that's why I say, don't ever get away from using your books, all right? And it's just a tool to help you. And while we do at my facility have access to the 3M encoder, which I love, it does not mean that they don't give us our books. They give us books every single year. I'm very fortunate in that they do give us those. And I'm very thankful, because it's good to have those. It's good to have it supplied by your employer. But yeah, I have those. They give them to me, and that I still use them. And I will also use them when I'm providing education to my providers, when I have to see them in the hallway and we have to have a little discussion about why they're not getting a certain procedure like they want to. And I will show them the book. This is why, because they say, well, Blue, I selected that code. I understand that, but here's why that code does not fit. This is the better code. Oh, well, I didn't know about that code. You see, my buddy told me, and I look at them. Whenever you hear that from a provider, well, my buddy said, is your buddy a coder? Are you seeing another coder? and they go, no, Blue, no. Well, okay, I'm the coder. And just because your buddy heard it and your buddy found this out, it doesn't necessarily mean that it applies to you. It's just like they have x-ray codes in the book. Does it apply to the ortho doc in certain situations? No, because that's the radiology that's taking care of that. The ortho doc, are they doing that? No. So I'm just saying, but that's my message for today, guys. Don't worry about things that are further down the road. Don't worry about, worrying about productivity and all this other stuff, because you will get faster in time. You will get faster in time. Things will get easier for you, and you will be able to learn the steps that's going to make it more efficient for you. But the thing that you need to worry about when you're a student is learning. Learn. Don't worry about a job. Don't worry about how much money you're going to be making. Don't worry about your productivity. Don't worry about where you're going to work at and your coworkers. I even had somebody one time tell me, well, I'm just concerned I'm not going to be able to get along with my coworkers. You're not even hired yet. You're not even there yet. And you're already worried about that? Really? And I had to give her a reality check, because I'm like, are you serious? Of all the things you can worry about, don't worry about that. You can't control that. You cannot control that. And to close this, let me say one more thing. This industry allows for a lot of gifts. And if your gift is your knowledge, if your gift is your personality, if your gift is your ability to be a worker bee and just not be able to just drown everything out, and that's your gift, that's fine. Embrace your gift. Because there's going to be people out there that won't like you just because you're you. There's going to be people out there who don't like you because you're happy. How dare you be happy? And they're going to say that it's inappropriate. Really? Well, when you're happy and you're glad to be doing what you do and you bring that joy, somebody else is going to find some good in that joy. And that's your gift, whatever it is. And yes, we all need to be professional, of course. But we all don't need to shrink down and be shrinking violets so that we can please others. You're going to upset other people just by being yourself. I know. People tell me all the time, do I care? No, because I'm doing what I love. And I'm genuinely happy with what I do. And I'm genuinely happy to help all of you. It is my hope that you all listen. It is my hope that you all take my advice and make it your own, and then you're able to do great things. That is my hope. But never shrink down because somebody else. Don't make yourself small because you want to try to make somebody else feel better. That's not the way that it is. This is why I tell people you've got to get a thicker skin when you're in this industry, because it's going to take all types. And it's all types that will encourage folks. It's all types that will open new doors to innovation with coding and even the industry itself. So that's why I say don't ever stop being you. Just be yourself. Of course, be kind. Of course, be professional. And of course, you want to make sure that you're paying attention to others and having empathy for them and showing that emotional intelligence, because emotional intelligence is very, very key for leaders. And you don't have to be in a leadership position to have those leadership skills. I'm just saying. So with that said, I'm going to wrap this one up. I hope you guys have a great weekend. I will see y'all back on Monday. Bye.